Women have several options for their care when it's time to have a baby, and now Women's Care is offering a unique collaboration of physicians and midwives in one building. In tonight's Parenting and Pregnancy, sponsored by Women's Care, KEZI 9 News anchor Renee McCullough shows us some things to consider when making the decision.
Dr. David Herrmann has been delivering babies for about 4 years, and like a lot of newer physicians, he brings a new way of thinking.
So really this shared decision-making model between patients and physicians and midwives is it's a little more central to training and kind of a hallmark of probably all newer physicians.
He says it's his job to make sure that moms-to-be know their risks and then let them decide what type of care suits them best.
It's really important for patients to feel that they're really comfortable with who they're seeing for their pregnancy and their prenatal care.
Madeleine Katz is a certified nurse midwife who works in the Women's Care building, helping women through their pregnancies. She says they work with women on everything from birth control to menopause and everything in between for those looking for a low-tech, high-touch way of doing things. But that doesn't mean it's all natural.
That's actually a very common misperception, is also that that midwives just work with natural childbirth. And we are really there to support our patients' options with pain management. And that could be getting in the tub and working with breathing, and that could also be getting an epidural when requested.
Another misconception, that midwives primarily attend births at home, when actually about 90% deliver at the hospital. She says they typically work with low or moderate risk patients, but the collaboration with Women's Care makes it much easier to bring in a doctor when needed.
The benefit is in that transition from when someone does go from lower risk to higher risk, that it's almost seamless.
Doctors and midwives already know and trust each other, because if there's one thing that Dr. Herrmann has learned, not only as a fairly new doctor, but also as a new dad.
I think that has helped to just kind of think of what it's like to be a patient, to be, what the different things the different symptoms women can have during pregnancy, even the things that we don't really think of as medical, like just everything smelling a lot stronger.
Women need to be as comfortable as possible when bringing a new life into the world.
You see a lot of your obstetrician or your midwife during pregnancy.